Hello everybody, my name is Marcia Viana. I am a registered nurse and a nurse practitioner student at Cal State Dominguez Hills. Today I'm going to discuss contraception methods, which are ways to prevent unwanted pregnancies and sexually transmitted diseases. Let's get into it. Next, we're going to talk about hormonal birth control methods. Hormonal birth control methods come in several forms, and they contain either a single progesterone hormone or a mix of two hormones, progesterone and estrogen. Estrogen cannot be used if the woman is 35 years old and smokes or has a history of blood clots or breast cancer. These hormones work differently, but ultimately work by stopping ovulation and making the cervix and uterus thick with mucus, making it difficult for the sperm to reach the egg. Smoking while taking birth control increases your risk of having a stroke or heart attack. The most common side effects of both birth control are spotting in between periods, sore breast, nausea, and headaches. This usually goes away in 2 or 3 months. This doesn't happen to everybody. Estrogen and birth control may lower the amount of breast milk and the quality. No breastfeeding is recommended while taking estrogen birth control. Hormonal birth control does not protect against STDs, and you shouldn't use it if you have blood clots, a blood clotting disorder, breast cancer, heart attack, or stroke, history of heart attack or stroke. You should call your provider if you experience sudden jaw pain, chest pain, difficulty breathing, or a strange achiness in your leg. Let's start with the IUD. The IUD stands for intrauterine device. These are small T-shaped devices that are inserted into a woman's uterus by her healthcare provider. There are two types, the copper IUD and the hormonal IUD called the Levon or gestrel releasing IUD. The hormone IUD works by releasing a small amount of progesterone into the uterus, preventing the woman from releasing her egg. The copper IUD does not contain any hormone and works by making the lining of the uterus thick with mucus, blocking the sperm from reaching the egg. The IUD has the lowest risk of pregnancy. Both are 99% effective in preventing pregnancy and breastfeeding safe. They can be kept in for a long time. The copper IUD can be kept in for 10 to 12 years, and the hormonal IUD can be left in for 3 to 8 years, depending on the brand. The IUD can be removed at any time and won't affect a woman's ability to get pregnant. It is convenient and does not require much maintenance besides checking for the IUD strings once a month. Some downsides to the IUD. Insertion may be uncomfortable. Sometimes patients can have cramping for a few hours or a few days until your body gets used to it. The copper IUD may have heavier or longer periods, and the hormonal IUD may actually decrease or stop a period, but sometimes it may increase the period. And unfortunately, it does not protect against STDs. Both IUDs have a small risk of moving around or even puncturing the uterus. If you suspect this, please call your doctor. If you're allergic to copper, you cannot use the copper IUD. If you have breast cancer or lupus, you cannot use the hormonal IUD. If someone has recurrent pelvic infections, cancer of the uterus, and some STDs, you may discuss this with your provider to see if you'll be a candidate, but most likely this is not in your best interest. If you suspect you're pregnant, experiencing chills, fever, trouble breathing, severe cramping, or can't feel your IUD strings, call your doctor immediately. Up first are the implants, also known as Nexplanon. The implant is a small rod the size of a matchstick inserted under the woman's upper inner arm by her medical provider. The rod contains progesterone that is slowly released into the patient's body, and it's effective for 3 to 5 years. This requires no maintenance, and the implant is 99% effective in preventing pregnancy and okay to use with breastfeeding. There is some pain sometimes associated with the insertion and removal, but that should be minimal. Patients should look out for signs of infection like redness at the site or any discharge. Most risks are with infection. If you notice the bleeding or pus, yes, call the doctor. Any yellowing of the eyes or skin or period much heavier from your vagina, always also call the doctor for that. The next contraceptive I want to talk about is the injection, Depo-Provera. It is a progesterone-only shot that a woman gets in her arm or buttocks that is effective for 3 months at a time. It is convenient and long-lasting and does not require any insertion or removal, just one shot every 3 months. And the shot is 96% effective in preventing pregnancy and is okay to use with breastfeeding. It's important to use condoms 7 days after the injection to avoid pregnancy. After 3 months, it's important to remember to get the shot again, or there is a risk of pregnancy. Depo does not prevent any STDs. Most common side effects are changes to a woman's period. They may be heavier, they may be lighter, and they may even be absent. Sometimes weight gain, headaches, or sore breasts. You should not use Depo-Provera if you have a history of breast cancer or blood clots. There's also a risk of bone thinning that is usually reversed when the injection is stopped. Call the doctor and report any severe depression, suspicions of new migraines, and any signs of infection. Up next is the birth control pill. There are two kinds of birth control pill, progesterone and the combination of estrogen and progesterone. It is prescribed by a doctor and the pill is taken at the same time each day. The progesterone-only pill is effective for 48 hours, and the combination is effective after 7 days. So one must use backup birth control methods meanwhile. If you're 35 years of older, smoke, and have a history of blood clots or breast cancer, you should not. Let's talk about implants, also known as Nexplanon. The birth control implant is a small rod the size of a matchstick that is inserted under the woman's upper inner arm by her medical provider. The rod contains progesterone that is slowly released into the body, and it is effective for 3 to 5 years. This is easy and requires no maintenance. This is 99% effective in preventing pregnancy. Sometimes there is some pain associated with the implant being put in and taken out, but that should be minimal. The patient should be looking for redness or infection signs such as discharge. The next hormonal contraceptive I want to talk about is the injection, also known as Depo-Provera. This is a progesterone-only shot that a woman gets in her arm or buttocks that is effective for 3 months at a time. This is convenient and doesn't require any insertion or removal. The Depo shot is 96% effective in preventing pregnancy. Use a condom for the first 7 days after the injection to avoid pregnancy. After 3 months, it's important to not forget to get another shot or you are at risk for getting pregnant. Most common side effects are the changes to a period, which may be making it heavier or lighter depending, or maybe no change. Call the doctor if you notice things like severe depression, difficulty breathing, or chest pain. I want to talk about the birth control next. Birth control pill, excuse me. There are two kinds of birth control pill, progesterone, and the combination estrogen progesterone. This has to be prescribed by a doctor and taken every day. Progesterone only is effective after 48 hours of starting, and the combination is effective 7 days after starting. So you must use a backup birth control method meanwhile. The birth control pill does not involve a shot or implant, very easy to use as long as you take them every day. The progesterone pills need to be taken every day within 3 hours to prevent ovulation. Up next is the birth control patch. There are two brands of birth control patches in the US, the Xulane and the Twirla patch. You wear them on your belly, your buttocks, or your back. And these hormones that are used are estrogen and progesterone. And this patch is 93% effective when used correctly. The birth control ring is a convenient birth control that works by wearing a small flexible ring in your vagina that releases progesterone and estrogen. You wear the ring for 3 weeks and you take it out for 1 week to have your period. The ring is 93% effective. There are 2 brands. The Nuva ring lasts for up to 5 weeks, and the Anovera ring lasts for 1 year. The diaphragm and cervical cap are barrier methods that are placed inside the vagina to cover the cervix and block sperm from entering. Both the diaphragm and cap are used with spermicide to prevent the sperm from entering. The patient must see a provider for a proper fitting. For the diaphragm and cervical cap, they come in different sizes and they are 93% effective when used correctly. This is good for people who do not want to use hormonal methods, but they can be difficult to use. And they need to be used every time that a person has sex. And sometimes the spermicide can be irritating to the skin, causing breakdown, making the patient more susceptible to HIV. Call the doctor if it hurts when you urinate or if the diaphragm feels uncomfortable. This may not work for somebody if they do not feel comfortable having their fingers in their vagina, allergic to silicone or spermicide. Sometimes this can make you prone to a urinary tract infection. So if you have a sudden fever, hurts when you urinate, a sudden rash like a sunburn, you should call your doctor right away. Patients should be also aware of signs of toxic shock syndrome and call the doctor in that case as well. And the next birth control method I'm going to talk about is the sponge. This is a small, round, soft sponge that's inserted deep inside the vagina before sex. The sponge covers the cervix and contains spermicide to help the sperm from entering the cervix and preventing pregnancy. The sponge has a fabric loop attached to it so that it is easy to pull out, and it is 78 to 86% effective in preventing pregnancy. The advantage of the sponge, it is sold over the counter. You could put the sponge in 24 hours before sex and you don't have to worry about birth control. Most people can't feel the sponge once it's in their vagina. Some people prefer a non-hormonal birth control method, and this is helpful for some people. This is safe to use during breastfeeding. Some people have trouble inserting the sponge. Practice might be helpful for some people. You have to make sure to leave the sponge in for at least 6 hours after the last time there was sexual intercourse, but no more than 30 hours in total. This does not protect against STDs. Again, because spermicide can irritate the vagina, this can make the skin prone to STDs and infection. Call a doctor if you have a sudden high fever, rash that feels like a sunburn, diarrhea, or vomiting. And again, toxic shock syndrome symptoms can be decreased if you, chances of toxic shock syndrome can be decreased if you don't leave the sponge in longer than 30 hours and never use the sponge on your period. Let's talk about condoms. External condoms are small, thin pouches that cover a man's penis during sex and collect the semen. Condoms prevent pregnancy by stopping the sperm from getting into the vagina. Some types of condoms also help prevent STDs. Condoms are 87% effective, easily effectable, available over the counter, and also prevents against STDs, like I said. The condom is put on before sex, safe to use one time, must be removed after ejaculation. Do not use latex condoms if you're allergic to latex. Call your provider if the condom becomes broken for emergency contraception. Report serious irritation and allergic reactions to your provider. Internal condoms, also used to be known as female condoms, are larger condoms. These are hypoallergenic and have less chances of having an allergic reaction. They are 79% effective at preventing pregnancy. And instead of going on the penis, they will go inside of the vagina or the anus, creating a barrier that stops the sperm from reaching the egg or entering the rectum. And this does, again, decrease your chance of contracting STDs and becoming pregnant. Some people may feel irritation on their vagina, vulva, penis, or anus when they use an internal condom. It's usually caused by friction. Extra lubrication can usually fix that. Call your doctor if there's a break in the condom to report. And last option I want to talk about in regards to the barrier method is going to be spermicide, which is a chemical that works by killing sperm. This comes in several forms: a gel, a cream, suppository, and a film. They're placed into the vagina no more than 1 hour before intercourse, and they can be left in place for 6 to 8 hours after intercourse. You can also use a spermicide in addition to the condom, diaphragm, or cervical cap. They can be purchased at drugstores, and when used alone, they have a 79% effective rate in preventing pregnancy. Spermicide does not have any hormones, and this is good for people who cannot have hormones. You cannot use this if you're allergic to any of the ingredients in the spermicide. You're going to want to call your doctor if it hurts when you urinate, because sometimes people may get a urinary tract infection, any fever, and things of that nature. Fertility awareness-based methods work by tracking a woman's menstrual cycle or observing a woman's fertility signs. Knowing your ovulation cycle will help lower the chances of pregnancy by refraining from sex on the fertile days. There are two methods that use this philosophy. The calendar method, which is determining a woman's fertile period by tracking the duration of her menstrual cycle and using a formula to determine her fertile days. And similar to this, the standard days method has a woman would track her menstrual cycles and avoid sex on day 8 and 9 of their menstrual cycle. This is a more broad approach and therefore is not as specific. The calendar method and standard day method are most effective when a woman has an understanding of just how long her menstrual cycle is. This can be attained by counting the days in between periods. For the calendar method, it is recommended that you keep track of at least 6 period cycles before using this method as birth control. Benefits to the calendar method is that it is affordable form of contraceptive, and it is also fairly effective if done properly, 77 to 98%. Disadvantages are it does not protect against STDs. You have to be vigilant when collecting all the necessary data in order for this to have an effective form of contraception. There will be days where you cannot have sex, and people who shouldn't use this method are people with irregular menstrual cycles, women with short cycles less than 26 days, or longer cycles more than 32 days. The other method that falls under fertility awareness-based methods of contraception is observing fertility signs. This can be accomplished with two methods. One, temperature method, which monitors the slight increase of a woman's temperature that is associated with ovulation. And the cervical mucus method, which tracks the cervical mucus changes in a woman's vagina through the month to help determine ovulation. To successfully use the temperature method, you must first record your temperature the exact same way as soon as you wake up every morning for at least 3 months. This will allow you to have enough data to recognize the slight changes in the body temperature that are associated with ovulation. The cervical mucus method also tracks the frequency of vaginal discharge to help determine ovulation and fertile days. The advantages to these methods is that they are both inexpensive and available to everybody. When performed correctly, they can be 77 and 98% effective. The disadvantages are that they take a lot of dedication and do not protect against STDs. Lactational amenorrhea method is a method of contraception that is naturally occurs when you exclusively breastfeed a newborn child, which causes your body to naturally stop ovulating, which in turn prevents pregnancy. A newborn's mother must be exclusively breastfeeding the child at least every 4 hours during the day and every 6 hours at night. This will trigger the body to stop ovulating and the mother to stop having a period. Advantages of this method is this form of contraceptive is free, accessible to anybody, hormone-free, and very effective, 98%. No prescription needed, and it also does not interrupt sex. Some of the disadvantage of this form of contraceptive is that it only works for the first 6 months after you had the child. After this, your period returns. This form of contraceptive does not prevent STDs. If you use a breast pump or feed your child anything other than breast milk, this form of contraception may not be as effective. This method can also lower the vaginal lubrication, which makes sex uncomfortable. Coitus interruptus, or pulling out, is exactly what it sounds like, pulling the penis out of the vagina before ejaculation. For coitus interruptus to work as well as possible, you must do it right every single time. For the best results, you should use along with another form of contraception, such as a condom. An advantage for this method is that it's free and always available. Disadvantages for this method are that it's only 78% effective and does not protect against STDs. Not everybody can use this method successfully. Young men, sexually inexperienced men, or men who suffer from premature ejaculation may not be able to successfully perform this method. Female and male sterilization, also known as tubal ligation and vasectomy, respectively. Tubal ligation is a surgical procedure that permanently closes, cuts, or removes pieces of the fallopian tube, therefore no longer allowing ovulation. Vasectomy is a simple surgery where the small tubes in a man's scrotum that carry sperm out are blocked off, cut and blocked off. The sperm cannot leave the body and does not cause pregnancy. The advantage to these methods is that it's highly effective in preventing unwanted pregnancy to 99%. The disadvantage is that it is permanent and should only be used if absolutely positively sure. Does not protect against STDs, can be costly if you pay out of pocket, but these procedures are normally covered by the medical insurance, including Medi-Cal and PACT. You must contact your doctor if you experience signs of infection after surgery, such as redness, tenderness, fever, discharge, or a fever. Signs of pregnancy in rare cases, fallopian tubes can reconnect and become unblocked and lead to an ectopic pregnancy. Emergency contraception is not a regular form of birth control. There are two options for emergency contraception. The copper IUD, as we discussed earlier, could be used within 5 days of unprotected sex to prevent ovulation. And there's the emergency contraceptive pill, also known as the morning after pill. The Plan B, one step, must be taken within 3 days after unprotected sex. And the Ella pill can be taken within 5 days. These pills basically work by delaying ovulation. If you weigh 195 pounds or more, Ella will not be as effective. And if you weigh 165 pounds or more, the Plan B option may not work. The IUD may not be available within 5 days since it requires a provider to insert. Sometimes it may be difficult finding a provider within 5 days to get the copper IUD in, but it is non-hormonal, won't intervene with breastfeeding, just can't be used if you're allergic to copper, as we discussed earlier. The Plan B progesterone pill also won't intervene with breastfeeding.